Maggie, we're so grateful to have you with us. And now I turn it over to you.
Tonight is a little bit different than usual. I'm here tonight because of what I do professionally and what I'm interested in, what I'm committed to. I am a clinical psychologist. I'm a researcher. I'm a worker. I work and I advocate with and for people with BPD and people who have a trauma history. I do research to understand the relationship, like Kathy said, between trauma and risk generally, looking at the brain, looking at behavior, looking at this a number of ways. All of those things are true. But that's not going to be my focus tonight. Instead, I'm here to talk about my family and my experience and the things behind the work that I do. So I'm going to be talking about me as a woman, as a wife, as a family member, as a clinical psychologist with all of the roles that that implies. But that part's easier. The trickier part, and I think the weightier part, and the part that I'm a little more concerned about making sure that I do justice to tonight is where I come from, because I'm also the child of intergenerational trauma survivors and someone who's had the privilege and sometimes also the sorrow of being shaped by and loving and losing family members with borderline personality disorder. So I'm here tonight to talk to you all about why I went into clinical psychology, my experiences as a family member of people with BPD, and the ways this part of my identity has affected me in good and less good ways, incredibly meaningful ones overall, as well as some of the resources that I've found to be incredibly helpful along the way, some of which I think you're already familiar with, and some of which I hope will be new and helpful. I'm not here to provide specific answers that'll be perfect for everybody. Certainly not here to make judgments. I'm DBT trained, and so you'll hear me using some of the lingo. You'll hear me advocating repeatedly for embracing a dialectic, certainly a few times tonight. I also want to be careful with what I share because I'm a family member, and what that means is that these aren't just my memories. So, my hope is tonight that you'll get a sense of the incredible people that I have had a privilege of growing up with, their strengths and their struggles, how those things have affected me. I'm going to focus tonight, in fact, specifically on two people. These are not the only people in my life that I've known who've had BPD. They're not the only people I've loved who've had BPD. They are the two that I knew the longest and that affected me the most profoundly who had BPD. So I'll talk about me. I'll talk about my family and trauma and BPD and how those things interacted, why that led to me becoming a clinical psychologist and how it's affected my work in that field, and then what I learned from the people in my life with BPD, and some of the skills and lessons that I've taken away from that that I hope will be helpful to everybody here tonight as well. So this is me. This is my mom, and this is my twin sister. I am the one with the brown eyes on that side there. My mom was our primary parent from the time we were around 4 years old. She's a teacher. She would work tutoring jobs after school in addition to a full-time teaching job, teach night classes, and my sister and I would often tag along. My mom came from a big family. She was born in the middle of 9 brothers and sisters, and both of her parents were academics. Their family moved around a lot. They experienced a lot of really cool things in a lot of different cool places. They also survived a lot. I knew all of my aunts and uncles to varying degrees, many of them well, but I'm going to be talking about two of them in particular today. And I'm going to be talking about those two because of their importance in my life specifically. So when my mom and dad separated, her siblings, and especially those that she was closest to, stepped up in a huge way. And for me, there was one aunt and one uncle in particular who I was connected with and looked up to. That was true for a few reasons, but I think part of what shaped that and my connection to them was the things that we shared. I wanted to be them when I grew up, I think is the simplest way of putting that. My aunt, you're going to be seeing drawings and illustrations on a number of the slides tonight. Almost all of them are the work of my aunt. My aunt was an incredible artist. And I loved to draw from the time I was really little. So that's something we shared that was a powerful connection for us. My uncle was smart and funny and had a gift for making me feel like being different wasn't a bad thing. I'm an introvert and always have been. And as a kid, especially, I was incredibly shy. I was really quiet, not always because I didn't have anything to say, but often because I was more inclined to listen, and sometimes because I was afraid to interrupt. He would talk to me though. have detailed conversations with me about things I found interesting as if I was an adult. He made me feel seen and understood. Being compared to both of these people, sharing things with them, meant and means a great deal to me. Still means a great deal to me. But, and I wasn't just quiet because I was shy. I was also, probably always, and then increasingly, as I'll discuss, very aware of and interested in other people's emotions. I don't remember a time when I wasn't sensible of and attuned to other people's emotions and potential, even likelihood in interpersonal situations for some level of tension to exist when interacting with other people. That was true to different extents, but especially when I was around people that I really cared about, that I was really paying attention to. I was first aware of consciously linking that tension to both of these people that I loved. To my aunt, to a greater extent, at first around ages 9 or 10, although I know that it was present before then, but that's when I first became consciously aware of it. More emotion, more conflict, more energy in those situations. I heard both of these people I loved being talked about and talked to differently, with a tone implying the need for private conversation and caution. I started ultimately and pretty early to speak to and behave around both of these people differently, um, and with more caution. And again, for a long time, more so my aunt, more carefully, with more conscious thought. And I was aware throughout my life that both of these people had achieved incredible things. Professional awards, publications, creation of incredible pieces of art like what I'm showing you here. But also that both had suffered really meaningful losses and setbacks across settings in work, relationships, in sobriety. And this was a huge part of my life. Both of these things, the highs and the lows, were huge parts of my life and affected me in various ways. And that was true, but it wasn't something that was talked about openly, or at least it wasn't something that was talked about without pain and consequences for everybody who was involved. So I want to take a step back and talk a little bit about me and my experience and how the way that I thought about these things started to change and my appreciation for what both of these people that I love experienced changed in some meaningful ways. When I was 16 years old and I was in high school, I was in a car accident with my mom. And we were driving to school, and the car slid on some black ice on a roundabout, which is an exit from the highway that kind of goes in a loop. So we were fine initially, and then the car behind us slid into some of the same ice. And I developed and was ultimately treated for PTSD. And I started to recognize gradually some of the same symptoms that I was experiencing had a lot in common with the symptoms that I'd seen in the people that I loved. Not perfect overlap, but certainly parts. Things like spacing out and feeling like I couldn't totally stay connected with what was going on around me the way that I used to, which was being very hyper attended to what was going on. So dissociative experiences for the first time in my life. Getting angry for reasons that I couldn't completely understand or explain in the moment. It was painful. It was frightening. It forced me to confront a much wider range of emotions than I was used to appreciate how challenging it was to try and live the same life, accomplish the same things, while navigating some really extreme emotions that I didn't understand, I couldn't control. So when I went to college, I studied both art and psychology. And ultimately, I settled on a career in clinical psychology, deciding to focus directly on trauma with the goal of trying to expand my understanding of what was going on for people like me and members of my family. That might sound like it was a natural and an easy decision because of what I'd experienced and because of the people that I loved and what they'd experienced, and it absolutely was not for me. It's true that learning for me has always been healing in a sense. So, like a way of gaining some measure of control over things that felt really uncontrollable. And for me, learning about PTSD did help. And it was also painful at times. It led to some pretty intense self-doubt at times. My teachers, for example, while they were wonderful, while they were helpful in many situations, would do things like recite prevalence figures, sometimes even say things like, That means one in every two of you or any 10 of you in the audience. So referring directly to us and the potential for the things they were talking about to affect us. But then would seem to forget about the likelihood that one of us had lived experience when they were choosing the words that they would use to describe symptoms and outcomes. So avoiding psychology and focusing on PTSD was really tempting because of the way that that affected me. But ultimately, that wasn't the call I made, and I'm glad that that's the case. The choice to study PTSD first was personally and professionally really rewarding, and I felt relevant to both me and my family, and that was true to an extent. It's also true that I didn't really learn about BPD, borderline personality disorder, in any really meaningful, deep way until I was about 2 years into graduate school. And by then, I'd heard about BPD a lot, but without really understanding the diagnosis. And I wish that wasn't as true as it is for, I think, a lot of us. But I still think there's so little good education about this diagnosis that that's commonly the case, even for people who are pursuing education in psychology. What I had heard was casual comments from clinicians, from educators. I'd heard enough to be very sure, based on the tenor and the nature of those comments, that the label that was being used, BPD, couldn't be the one that was being applied to the people that I love. That couldn't be what they were talking about. Except it was. It was exactly the right label. Marsha Linehan describes people with BPD as the psychological equivalent of third-degree burn patients. They simply have, so to speak, no emotional skin. Even the slightest touch or movement can create immense suffering. I'm sure this is a quote a lot of you have heard. I read it here tonight anyway because it's one that was incredibly compelling to me. And the first one, when I read it, that really kind of knocked the wind out of me. The first one where I read it and I knew exactly what she meant. I recognized what she was talking about. I recognized and I felt like somebody understood what I had seen in the people that I loved. Um, I'll say that for me, there was a relief and an empowerment that came with the awareness of the diagnosis. That's for me. I'm not speaking for anybody else because I think labels have good and bad that's attached to them. I felt for the first time like maybe I could really help understand. I was also extremely wary. And I was extremely wary in part because I was also a student at that time, and that meant I was reading the DSM-5, which is the diagnostic manual, and that meant I'd read the diagnostic criteria for BPD. And I think those and the language that's used there kind of nicely encapsulate why somebody might be very wary about this diagnosis and some of the implications that it might have. Um, so to be fair, these words have not been revised in decades. And on the other side of things, the diagnostic criteria for BPD include the words frantic, inappropriate, intense, extreme, and three variations of the word unstable. These are words that I would argue likely reinforce stigma and judgment. And that stigma and judgment of the people that I love, right? And some of the people who are here tonight to listen, some of the people that the people who are here tonight to listen love. I'm not saying finding better words is easy. These aren't easy things to describe. I'm saying we should do it anyway. But moving past words to the meaning and how it matched up with my experience, I want to talk a little bit about what I saw in BPD, how that matched up with my experience, and some of the things that I learned from it and how it affected me and how I turned into a psychologist, how I developed as a person. So talking generally about BPD symptoms, my primary observations thinking about kind of the interpersonal symptoms we think about in BPD concern my aunt when I was littler. I remember this in little ways mostly, being engaged with her on a project, for example, getting really excited about something like drawing something or doing art, as kids tend to do, and then getting distracted, not paying close attention or not responding quickly enough. And then noticing that she'd shut down, noticing that she was looking away, or all of a sudden she wasn't interested in me, was not responding to me and my sister or my cousin were the ones that she was focused in playing with, and not understanding what had happened where that had switched. I remember asking my mom before we went to visit her, relating to interpersonal relationships more directly, if it was okay for us to mention her long-term boyfriend and their relationship, because I had a recognition, even at a very young age, that that might not be a safe or a wise thing to do. I remember really intense hurt and refusal to speak with me when I didn't send a thank you note for a gift that she had sent me, despite the fact that at that point I was really young and didn't really even understand thank you notes or why not doing so might have hurt her feelings. And I remember reacting to other people, especially my family, differently after reactions like this. Not being sure why she'd reacted that way, but she mattered so much. And so wanting to be careful to make sure I understood what it was in my behavior that was causing those reactions and make sure that that didn't generalize, that other people didn't react to me in that same way. Impulsive behavior was another big one, and also a tricky one to navigate as a kid. So, spending on things, for example, going on adventures, I would be excited about, wanting to share in, wanting to be a part of high emotion and excitement. And I also remember a sense of unease, like I was getting away with something because I wanted to avoid conflict and trouble. I remember feeling like I was thinking responsibly earlier than I probably should have been, like I was being too serious. Learning about substance use and seeing its effects, wondering if I could have or should have done something to change it. And similar thinking with respect to suicide and self-harm. Those were my experiences for both my aunt and later on with my uncle. I understood substance use and self-harm specifically as kinds of self-medication in the case of my aunt and my uncle, and I understood that from a very, very young age. I don't remember not thinking about it that way. Before I had any interaction with psychology, that was my thought about these things. And I honestly don't know if that was articulated to me or if it's something I picked up by observation. The effect, though, was that when my aunt or uncle were using substances, and I wasn't often exposed to them in person, certainly when they were, but by the phone or any time that I was exposed to them, even peripherally, I was afraid of them. And it was a very different experience of these people that I loved. And to be clear, not afraid of physical harm, afraid because I felt like I no longer knew the rules. And then at the same time, I blamed myself because I felt guilty for feeling that way about people that I really cared for, that I loved, and still felt those same positive things for. And I think probably the biggest and most consistent thing that I saw across my aunt and uncle, especially my uncle later in his life, was variability in mood. One minute things being wonderful, and the next, the world ending. And I use that degree of hyperbole without, too much excess there. Or them being silent and unreachable. I didn't see either of them all the time, so these reactions, when they were that extreme, were really difficult for me, especially as a kid, to dismiss. I'll say I don't have a diagnosis of BPD, but I am really interpersonally sensitive, and I always have been. I watch other people, I pick up on their emotions, I empathize. I think it's part of what makes me a good clinical psychologist. And I've always found it painful to watch anybody in pain. I was the kid who, cried at the sad movies when I will never forget Littlefoot. I'm forgetting the dinosaur movie, but that movie I could never watch all the way through because he lost his mom. Um, and in particular, I found it painful to watch my aunt and my uncle in pain and begin to look out for signs, even really small signs that might have nothing to do with it, that might swing things in one direction or the other. Um, and because of that, I felt less safe, never physically, but emotionally in terms of stability. And I found myself getting more quiet, curating my conversation, avoiding extremes. And this was particularly the case when it came to anger for me. I would and still do react sometimes physiologically, very literally react to anger. My body will convince itself that I need to run away from danger, run away from a dinosaur, and will prepare accordingly. In the case where it looks like somebody is going to get angry with me. Um, so that's a very real consequence for me of some of the things that I've experienced. All of this is true. It's one extreme side of the story, and I want to emphasize that because all of the good and wonderful things are true as well, which is why I talk about these people that I love with such love. And I just want to come back to my point about language for a moment. because a lot of what I've just talked about was hard. So was going to graduate school and hearing the people that I loved described like this. This is not an uncommon acronym that's used across some clinical and medical schools to describe BPD symptoms, right? Please don't use this to describe a person. A vibrant, talented, loving, and loved human being who will touch the lives of others in good ways, in bad ways too, but in a lot of good ways. So what did I learn? What did I take away from this? How has this changed my life? The answer is profoundly. And I think in a lot of ways that have shaped me and enabled me to, I hope, do a lot of good and help learn a lot of important things that can change things for a lot of people in some good and important ways. Most directly, after learning about BPD, I read as much as I could about BPD, about PTSD, about trauma, about the relationship between all of the above. I'm still learning. But as a family member, here are some of the biggest and most helpful lessons that I've learned. And the first one, I think, for me is about setting boundaries. I believe that setting boundaries is essential for any healthy relationships. And I'm going to say that that generalizes to pretty much anything that I'm going to say today. I also think it's true for DBT skills or CBT skills. I think a lot of these things are useful for life in general and living life well and effectively and the way that you hope to live it. I think the reality is that, including for family members with BPD, we can't read each other's minds, unfortunately. So long-term effective communication requires clarity, especially around the basics. What do you need to feel safe? What do you need to feel respected? Are there times where you need not to be available? Or where conversely, you need to hear from a loved one because maybe you're going to feel a little bit extra raw, or maybe you might have something going on that means you'll need extra support. Make sure that they know. Make sure that those boundaries are there and that there's clear communication so that effective support can be offered. Feeling comfortable expressing those boundaries and asserting those needs has taken time for me. It is an ongoing process in some of my relationships, especially. And it is one of the most important things that I think I have done and the most effective in terms of living an effective life and having effective relationships with family members with BPD. This second one, I don't like the wording that I put here. It's sounding to me now that I'm rereading it kind of like I'm intending some kind of surveillance, which is not at all what I mean here. Really, what I mean here is to be intentional and to be thoughtful. If you know that your loved one has an anniversary coming up, for example, that might be painful, make sure that you know what kind of communication for you would be helpful in those circumstances. Be intentional, be thoughtful, be have meaningful communication. Um, that more than anything shows caring, I think, and shows caring in a profound way. And remember that language matters. Remember that words have meaning, that words are things that last and that matter. I understand the sticks and stones metaphor, and observing family members with BPD and my own experience and reality, words do matter. Words can last to an extent, and so it's worth being careful with them. It's worth taking time to consider them, right? And it's worth addressing when we don't choose the right ones. It's also worth remembering that universal words are never true, which I recognize is a fundamental contradiction, but it is perhaps the only time that a universal is really true, right? So avoid extremes because you're never really going to be fair relying on those. Appreciating balance is another big one for me. And what I mean by this, and I'm using specifically these anger guys from Inside Out and Inside Out 2 movies, because I really appreciated the way that this movie articulated the universality of emotional experience. The fact that all of us have the same continuum of emotional experience, right? The idea for me here, don't treat people like they're fundamentally different as a function of a diagnosis. All of us have, maybe to different degrees at different times, maybe to different extents, in different fluctuations as the function of different stimuli, but it's the same base. the same type of emotions. Emotions are universal. They also exist for a reason, right? They serve functions. And understanding and appreciating that for me has been really key also to being able to appreciate and not take other people's emotions and reactions as personally, to not be hurt by emotional reactions, and to be able to therefore be effectively empathetic by in cases of emotional reactions that other people had difficulty controlling. There's also value, I think, in variety. These emotions serve a purpose. Some of the most intense and arguably negative emotions that I have felt in my life, I have also learned from. They've made me more able to understand and empathize with other people effectively. They've also made me appreciate the things that are sweeter in life more intensely, right? So while shooting for moderation is reasonable, and there are a lot of therapy tools that are designed to help you get there, right? Shoot for an emotional equilibrium. I have come to have a better appreciation generally for the value of emotions in my life. And the emotion that I struggled with the most specifically and had to do the most work with, as I mentioned earlier, is anger. This has been the trickiest one for me by far. It's still one that I react to. I do better with anger now because I consider it more analytically. And I do that by thinking about where it comes from and trying to approach this as empathetically and as thoughtfully as possible. So, for example, if a child comes home late from curfew and a parent is angry, understandably, why might that be? Maybe because they're scared for them, right? They're not angry out of nowhere. They're scared, and that pain coming from the fear is motivating the anger, right? It's a sort of a protective emotion. In a different situation, if a partner doesn't remember our anniversary, might also be a cause for anger, but the anger is not probably coming from the same place. You're not scared because the partner didn't remember your anniversary. You might be, there might be some fear there, but probably there's also hurt. So understanding, being able to parse out what's under something that can be fixed, considering this in the context of the parable with the lion of the thorn in its paw, reframing anger in that way has been most effective for me. Engaging in mindfulness exercises around tense situations has also been incredibly helpful in reframing in that way. And also remembering, crucially, that two things can be true at once. So if you see extreme emotion, if you see extreme anger, that doesn't mean that love, that the extreme positive doesn't still exist at the same time. Two things can be true and probably are and inform each other, right? That's one of the beautiful things about life. And one of the hardest things, I think, for us to appreciate and to hold, because it certainly doesn't feel true when we're at one end of the spectrum and we're really focused on that one end. I also want to make sure that in focusing on the negative, we're not losing sight of some of the really incredibly positive things that I have had the benefit of getting from and learning from having family members with BPD. For example, learning from these relatives, I believe, has made me a better therapist. It's made me a more critical thinker in some incredibly meaningful respects. It's made me a more resilient, a more empathetic person. I think probably a more insightful person as well, for a number of reasons. Insight, appreciation for the nuances of emotional experience, all of those things. Some of them are based in our shared genetics. A lot of them are based in shared experience and the things that I learned from watching the hurdles that were faced by my family members, navigating hurdles with my family members. This is a quote from Rupi Kapoor that does and has always moved me. I don't know what living a balanced life feels like. When I'm sad, I don't cry, I pour. When I'm happy, I don't smile, I glow. When I'm angry, I don't yell, I burn. The good things about feeling in extremes, the good thing about feeling in extremes is when I love, I give them wings. But perhaps this isn't such a good thing, because they always tend to leave, and you should see me when my heart is broken. I don't grieve, I shatter. The good and the bad can and do exist together and inform each other. So I've been using the past tense, and I've used the past tense because we lost both my aunt and uncle, both unexpectedly and shockingly before I was licensed to practice clinically. I won't say that I dealt with this easily. I won't say that I dealt with it elegantly, or even that I'm through dealing with it. I think this is a lifelong process. Um, I'll say that the quote that resonates with me most about this topic, because I don't have universal advice here, I wish that I did. But the quote that resonates with me most about this topic is that grief is love that has no place left to go. And if that's true, then healing is redirecting love and effort down a new path. And that's my way of saying that the work that I do is, in a very real sense, a love letter to my family. So these people, because of whom I have felt incredible pain and joy that is sweeter because of it. I've seen the other end of the continuum, and that gave me confidence, taught me to appreciate nuance, to rethink my goalposts. And though staying on that path for me is and will always be a process, I am incredibly grateful for it. So Marsha Linehan, again, I'll quote her multiple times, and have learned a lot from her, has described acceptance as a process of turning suffering you can't tolerate into pain that you can. So figuring out how to turn one thing into another effectively. And for me, personally, and this looks different for everybody, but for me, that looks like remembering, having the opportunity to do things like this, to talk to people like you, who I'm so grateful for being here and hearing this. Doing my own art, remembering the things and celebrating the things that my aunt did and did so well. Working as a clinician and getting to help other people. And doing research, trying actively to understand why it is that trauma and trauma-related psychopathology are associated with risk and too often lead to loss. And to figure out and to keep that from happening to me, to other people, to anybody again. It's also meant in a very real sense for me, changing my outlook on life and on learning so that I appreciate that this is a process. Life is a process, so that I focus less on the goal and more on the things that I'm achieving as I'm achieving them, focusing on the present moment, being here in the present moment, mindfulness, right? I don't do well, and I'll talk about skills a little bit, but I don't do well because I am somebody who thinks a lot of thoughts very rapidly, just always have. I've got a lot of rumination going on, and that's something I have trouble fighting. I don't do well with mindfulness exercises that are directed. I do great with mindfulness-based art exercises because those are immersive. So I think it's about finding the things that work for you. And there's so many different options, so many different great resources. Fortunately, there are those. Other things that work for me and that have been effective, focusing on the journey. Self-disclosure. I have the privilege of being in a position where it is safer for me to talk about BPD and to talk about my experiences. And I believe that talking about BPD and trauma and suicide is the only way that stigma is going to change. I also recognize that it's not always safe to do that, depending on where you are, who you are, the position that you're in. It doesn't always feel safe. It's not always safe. Um, and so this is a choice that I've made. It's one that I'm grateful for. It's why I'm so incredibly grateful for opportunities like this. I also do a lot of advocacy. I work with groups like the Incredible Sash Bear, groups like the National Education Alliance for BPD and Emotions Matter in America to spread awareness, increase resources, and fight against discriminatory laws, and focus on self-care. There's a lot of different self-care techniques that I think are effective. Some of the sort of primary ones that I focus on that I think are really effective and have been really helpful, especially for me and especially in working with and learning to love effectively family members with BPD, surround communication. Um, Being aware of other people's sensitivities around communication, words to use and not to use, tones to use and not to use. And when I say sensitivities, I mean mine, I mean the other person's. I mean, in any relationship, I think this is the case. Based on whatever our learning history is, whatever we've experienced, we're all going to feel and experience things differently. And keeping that in mind is crucial. Being direct, saying what you mean and saying it as straight out as possible, gently, but using the words you mean to use. I have found to be extremely important, being deliberate and intentional about what I mean to say. And then offering reinforcement, being sure that when I appreciate something, when something is meaningful to me, I take the time to say it, right? Not just recognizing the bad, but really saying when I appreciate the good, especially when I know that the thing that somebody did was difficult for them. And making sure that I take the time to take a step back when I think perhaps I am being hasty or I haven't thought through what it is that I might be intending to say so that I can preserve effective communication and relationships that are so central to everything. Because fundamentally, as humans, we are social creatures, and that's incredibly important to us being happy. Self-care resources. There's a lot of really good stuff out there. These are just a few, and I've sort of varied here in terms of what I've got, from the specific to the more general. I've got r/aw here. This is a Reddit that exclusively posts things that are cute and are likely to make you go aw. This might not be the thing that is going to do it for everybody. It does when I am just having a bad day and I just can't get over a bad moment or just can't get out of a funk. This is the type of thing that'll do it for me. It's just good, right? It's just going to generate the happy emotions and push me to that side of the scale. So I find things like this particularly helpful and useful. And there's a number of things along those lines that you can find. There's also apps that'll generate so that those will pop up on your phone randomly as a background, in case you need that as a boost. DBT and DBT skills. I believe, and I am DBT, CBT, PE trained. I wouldn't say that DBT is necessarily the one and only. I believe in DBT. I've seen DBT work, and I wouldn't say that it is my primary affiliation in terms of clinical orientation. Um, and I believe in it. I know that DBT skills do and can work. I also think that they are more universal than we often talk about them being. I think they can work for everybody. I think everybody can benefit from DBT skills. And there are various ways to learn them. There are lots of great programs out there now. I went to the conference of the or ABCT conference recently, and I met Diana Partington. She gave me this book. It's called DBT for Life, which is one of the ones that I've been reading through recently and have found really useful. It goes through DBT skills in the form of stories. So it's a different way of learning them and learning them in narrative form. I've personally found that useful, and it's useful for different ages. She holds workshops and various things too. This might not be the right fit for everybody. It's one thing that I've found useful. There's a different fit I've found for DBT skills for just about whatever you're looking for, which I think is incredible now. Mindfulness, needing to fidget, distraction, all of these different DBT skills. I keep fidgets of various kinds, puzzles around me all the time, wherever I am. Every office that I have has fidgets of various kinds, shapes, and sizes. Here's my Stitch fidget right here, right? Depending on what I might need. Virtually every meeting that I'm in, I will have a fidget. It's something that I've found makes me more effective, makes me think more clearly for various reasons, in addition to the sort of more acute purposes that it might have. And some more general advice that I think has been incredibly useful for me. Being very deliberate about avoiding pessimism. There is something fundamentally different, I have found, about saying and versus saying but in terms of tone and in terms of mindset. So if I say, I have to go to work, but I don't know what time I'll be home. Or if I have to say, I have to go to work and I don't know what time I'll be home. One feels like it opens up possibilities. One feels like I'm saying something negative followed by potentially something negative, right? Versus sort of opening up a conversation. That's not necessarily the best example, and I wish I'd prepared a better one. And try it, right? Try this the next time that you have a list of things. Try this the next time you're having a conversation. It does make a difference. Some more specific resources. Here's a few links for peer support. And I know this is being recorded and will be posted, so this will both be available. I've tried my best here to provide resources that are available both in Canada and in the US. And I know these are relatively universal through Emotions Matter and through at least one program in Canada. Family support resources. I know many of you have had the benefit of the Family Connections program. I have myself been through the Family Connections program and benefited tremendously from it. It's an incredible resource. I went through it through NEA BPD. I know Sash Bear provides Family Connections programming as well. I encourage you to check it out if you are a family member or loved one of somebody with BPD. It's a great resource. And then more general recovery resources, information for people with BPD, their family members, and loved ones. Other resources. This is alerting you more generally to the support groups, the many wonderful support groups that are out there. So, Sash Bear, I don't need to tell many of you this, but the Sash Bear Walk is an incredible way to get involved and to find community and support. One of the most meaningful things for me after I found out about BPD, understood that that's a part of my lived experience, that was a part of my family's experience, was finding community and understanding a place that I could talk about this, a place where I could match experiences and get advice. This walk has been going on since 2013 annually, brings together families, friends, people with lived experience, mental health providers, supporters, across Canada. It's an incredible thing. Um, Raises awareness, reduces stigma, makes crucial waves for mental health. Check it out. Other resources from similar groups. Emotions Matter is a group through the United States that I have the privilege of being on the board of. There's some specific resources that are available through that group, including things like specific informational pamphlets that talk about BPD in different languages, provide resources for family members and individuals with BPD on homelessness, and advocating for treatment coverage, which is what specifically is pictured here. And then the National Education Alliance for BPD houses the largest media library, I believe still internationally, that's available on BPD, on people's experiences of BPD, families' experiences of BPD, almost anything you could hope to find about BPD and the experience of BPD. I have partaken of a lot of it, benefited from a lot of it, and I'm very pleased to be able to offer that resource as well and recommend it. So just to reiterate, these three organizations, getting involved with them, checking them out, visiting their web pages is something that I highly recommend. Building that sense of community makes an incredibly meaningful difference. And I'll end today by saying this is an aspect of my identity, being a family member of people with BPD, that I take pride in and that I've experienced stigma for, that I've been judged for. That judgment, the associated stigma, still makes me frustrated, makes me angry. But more profoundly than that, it makes me sad. And I'm not trying to suggest that anyone is right or wrong for feeling any specific way based on what they've experienced. My point is this: as with so many things in life, if all you can see is a label, and yes, all the negatives that come along with a label, most labels, you will miss out on some genuinely incredible people and everything that they have to give. For me, having family members with BPD, like a lot of things in life, can be painful, it can be challenging, and I wouldn't change it if I could.
That was amazing, Dr. Mankey. Thank
Well,
you for sharing your story and just sharing it so eloquently about that. So we'll move into a couple of Q&A. There are a lot of folks that had shared that same sentiment about finding a lot of offensive descriptions of people that suffer with BPD when they read BPD books. And you had mentioned, although sometimes in our worst moments accurate, it's just not nice to read those. Are there any resources that come to mind for books or resources that speak a little without judgment?
list. Yes, Marsha's memoir is a great one. It'll talk about personal experiences and the reality of personal experiences. The word used and the specifics aren't going to resonate with everybody. So the language isn't going to be a perfect fit for everybody. So I think it's hard. It's hard to find
Mm.
that one that'll be right. But I think if you look at the lists on groups like the websites of Sosh Bear and NEA BPD and Emotions Matter, you're going to find a fit. You're going to find one or a couple that are going to be a good fit, and I'll be happy to post that list.
But is there a non-clinical way to describe BPD that our loved ones could use to share about BPD in a more informed way instead of a judgmental way for those ones they're sharing that with?
So, in the context of my research, I don't always use the label because
Mhm.
of the amount of stigma that surrounds the label. Whether or not I do depends on the setting, depends on the comfort of the people that I'm working with.
Yeah.
Uh, Oftentimes, when I talk about BPD, I talk about it in the context of the things that characterize BPD. So, I
Mm.
talk about it in terms of the things that people with BPD experience. So, my loved one struggles with emotions, really intense emotions and emotional
Mhm.
ups and downs, with impulsivity, with sometimes taking risks, with sometimes having trouble in relationships. I think a lot of these things are difficult because they're also things that we tend to society to judge and shouldn't, because I think
Right.
the truth is that a lot of us have trouble with those things to varying degrees, right? All of these things exist on a continuum. But I think addressing it behaviorally in terms of the specifics is the best way that I've found.
There's just that feeling of like, how do I get my loved one to be diagnosed or to be seen or cared for? So are there any recommendations? No, this is not about how to fix our loved one, but really I think it comes from a place of support from these questions. Is any advice or suggestions you can give on getting a loved one diagnosed or getting them support?
Best advice. There's not, you're right. There isn't going to be one solution. If there was, I would be so delighted to offer it to you. And it
Mm.
would solve a lot of problems. Um, my best advice would be meet them where they are. So ask them what it is that they would most like to solve. Make sure that you are approaching this with at top of mind the things that they view as the issues, right, that need to be
Mm.
addressed. So if they're most concerned about relationships, if they're most concerned about getting a job, if they're most concerned about a specific thing,
Hmm.
offer a resource or maybe education surrounding BPD or surrounding a treatment that relates to that specific resource. So offer something that's going to provide them with a tool, with something useful that will provide them with agency related to something that's meaningful to them. That can be frustrating and it can feel further away because it might not be your primary concern, but it'll
Right.
show them that what matters to them matters to you and that you're hearing them.
There's a segue to that around just feeling heard. When your loved one, you kind of want your truth to be heard and their truth, and there's a real interesting balance between their illness and the person that they are, and then your thoughts and feelings. Is there anything that you can kind of share around skills to find that balance or feel like you can have a more authentic conversation without compromise?
I will be honest with you, that's part of where the and skill developed for me. Um,
Hmm.
a lot of this for me starts with listening. So being willing and being open to listening first, to
Hmm.
reflecting, and then asking openly, honestly for the same. And
Right.
also accepting that you will not always get that back and having that be okay, right? It's not always going to be a perfect conversation, but if you get a little bit, right? If there's an iterative gain, and if you remember to validate, right? Because if your loved one with BPD is in a raw
Hmm.
place, if anybody that you're talking to is in a raw place and they make an effort to say, you said this and that was important and maybe I didn't recognize that last time. And then you sort of skip over that and say, well, but what about this too? You haven't rewarded that behavior. And maybe they feel like, well, I tried, but you didn't recognize it. Making sure that you recognize it and the effort that that took, especially when somebody's
Yeah.
raw, can make such a big
Mm.
difference. Because we remember that, right? I remember, I remember when I'm having my hardest day when somebody says hi to me in a hallway.
What is some advice you can give or respond to those? Or how do I approach this? I've just found this out, and how do I talk to my loved one? that has now just been diagnosed with BPD or an emotional dysregulation?
I would my first advice again, and I know this is similar to the previous, but I can't say it enough, is listen, ask open questions. So if
Mm-hmm.
your loved one has just received a diagnosis, right? They've just heard this news, there's got to be a lot running through their head. They've got to be worried about a lot. Um, it might be tempting for you to go into problem solving mode and look for resources and find solutions, and they probably already feel overwhelmed. I can't speak for them, right?
Right.
There's that possibility, but try to put yourself in their shoes.
Mm-hmm.
Be a
Yeah.
sounding board. Listen and listen and think critically about what it is that you hear and try to bring that back. So I remember when
Yeah.
we were talking about this earlier, I heard this. I found this that I wonder if it might be useful from what you were talking about earlier.
Hmm.
Or you mentioned this that somebody said about your diagnosis. Am I understanding this right? Ask them. Don't assume that you understand. Show them that you want to understand and that you're listening to what they're saying. I think allowing that agency is incredibly important, especially because getting a psychiatric diagnosis that feels like a really negative, stigmatizing label like this can
Yes.
feel disempowering in a meaningful way. So showing somebody that you are giving and willing to give them control over defining what that means and defining for
Mm.
them what that means and your understanding of that can be really powerful as well.
Is there
Yeah.
anything you could share regarding kind of those co-occurring pieces and insights
Yeah.
on that?
Yeah. This is from a research and a clinical perspective, a very real frustration of mine. Um, we've got at least a 90%, but probably a 96% estimated comorbidity rate with borderline personality disorder and most personality disorders based on our current diagnostic
Mhm.
system. We've moved in the ICD versus the DSM diagnostic
Right.
manual to a whole different way of thinking about personality disorders. And as a family member, as a clinician, I think I know what that means, but practically, I'm not
Right.
totally sure. As a family member, I'm not sure how to talk to people about that.
Mhm.
I'm not sure what it's going to mean clinically. And I don't know what it's going to mean in terms of diagnosis, right? So it's an ever evolving picture. In terms of trauma specifically, about 80% of people, and this is a rough number, but about 80% of people with borderline personality disorder, we think, experience trauma. And about 80% of people in life, about 80% of all people experience trauma in life. But we think probably about 80% of people with borderline personality disorder experience really serious trauma, a lot of them in childhood. And for
Mm.
a lot of them, that probably has something to do with how and why borderline personality disorder develops. Not all of them. And I think that's really important. I think it's easy to draw this connection between, not easy, I don't think that's fair. I think there is a tendency, there has been a tendency
Like
historically.
common.
Yeah, it's common to draw this
Mhm.
connection between trauma and BPD and to feel like what we're doing there is implying that parents have perhaps played a role or that trauma has been trauma has occurred and that might imply negligence or imply something negative about family. I remember feeling defensive when I first heard that conceptualization as a
Absolutely.
family, you know. Um, the reality is that there isn't one way to define trauma, right?
Mm.
If you are somebody who is, for example, neuroatypical and you experience the world differently, the way that you experience validation, the way that you learn might be very different from the way that other people do. So the way that your family provides you with love and tries to help you learn and provides you with validation might not do that the way that it would for another child. So the way that you experience the world, the way that you learn would be different. And that might mean that you experience something that looks like invalidation
Right.
even if your family is providing care and love and resources in an incredibly meaningful, nourishing way, right? Because there are differences that are fundamental. Or if there's a lack of resources because of hardship, or because there's a child in the
Mhm.
family who is ill and, demanding a lot of resources. There's a lot of different situations that could lead to potentially a child having a different experience growing up. and that resulting to differences in learning in terms of how
Mhm.
it's safe to relate to other people. Um, and that's part of how we think BPD develops, or one of the models of how we think BPD develops. So I think thinking of trauma in BPD the same way we think of trauma in the context of PTSD is problematic.
Now, there's a couple of questions around BPD as a label with stigma, and then BPD as a diagnosis that's supportive. So, how do we know, or how can we kind of sort through those?
I think whether or not BPD is a diagnosis or a label depends on the context and how it's used.
Mm,
So I think it's a little bit of a, I won't say a choice. I think it's a function of who's applying it and how it's applied. Um, I think BPD as a diagnosis in the best case scenario should be supportive. There's some research that came out of George Mason University recently. They named what they called the Rumpelstiltskin effect. So there's an old
mm,
fairy tale, Rumpelstiltskin, which many may
right.
have heard of, some might not have, about a man asking somebody to spin straw to gold. But ultimately, the way that the sort of idea, the crux of this is that the way to escape the bad consequences is to say the man's name. There's power in a name, is sort of the crux here. And so the idea of this effect is a lot of people, when they learn a psychiatric diagnosis, feel empowered by that, feel
Hmm.
relief, because they feel like that's what it is. That's what I've been experiencing. That's Thank you. That's that is it. This is not, this
Yeah.
makes sense, right? And now maybe there's a cure, and now at least I have a path, and there are other people who will understand what I've been experiencing. In that context, and when I'm saying it without judgment, and or when I am using this as a marker for community, it can be a positive. When I'm using this as a way to other somebody, it can be a negative. And I think honestly, increasingly, without getting political, that can be true of almost any word. So I think it
Yeah.
is up to us to be mindful about how we're using these words, the tone in which we're using these words, the context in which we're using these words, and the meaning we choose to ascribe to these words.
Mm,
So I will never say to anybody, you should use BPD as a diagnosis. It's the right diagnosis for you because for some people it's incredibly painful.
right.
The genesis of the BPD as a diagnosis is sort of rooted in stigma, right? Borderline in and of itself. Going
Yeah.
into that is a whole nother kettle of fish. And a lot of people really believe it's something we should change because of that. On the other side of things, it's also a label, a diagnosis that has a lot of meaning for people, that means community to them, that means that they have a connection to other people. And that's something that they wouldn't want taken away. Um, so I don't think that there is a simple answer. I think
Hmm.
words and labels are something that we can take back and take control and take power over. I think they're also a responsibility and something that we need to and should be mindful of, especially as advocates and family members.
Lastly, there's a couple of questions just about often people see BPD or emotional dysregulation as big and loud, and sometimes it's very quiet and inside. So someone might not want to speak, someone may self harm or cut. Is there any recommendation you can have on just how to bridge that gap, or how to respond to that loved one that's really struggling but just inside?
I love this question so much. I'm so grateful for this question because I do think we tend to go off the most common, right?
Hmm.
And it just isn't true, right? Depending on how you're there's 256 ways just based on the symptoms as they're written that BPD can present. It is not one.
Wow.
It's not one thing. It's not big and loud. It is as diverse as we are. That's the reality. And so appreciating that, paying attention to what people are experiencing. And then I think this is part of why advocacy is important because the people who are experiencing things in a more quiet way are less likely to be diagnosed because of what we understand BPD to be. And by we, I mean we as a society, I mean we as a medical community, I mean we as clinical psychologists, how we're probably likely to identify and to diagnose BPD. It's in people who are presenting in that louder way, you know? Um, and those aren't necessarily the people who could benefit the most from the treatments that are meant to target the symptoms of BPD.
But can you just speak, lastly, Dr. Maggie, just about the value of the skills and how it can feel really frustrating if you haven't got exposed to any of those DBT informed skills?
Oh my goodness, yes. Yeah. So Dear Man is a really good example. I just saw somebody out of the corner of my eye in the webinar chat talk about conflict and the necessity of conflict and how it can in fact be healing. There's that dichotomy again, right? The dialectic, good and bad and everything. Um, Skills like Dear Man teach us how to effectively communicate and navigate conflict, which is a reality of life effectively. Skills like TIP teach us how to leverage realities of our body and our biology to manage distress, which is a reality of what we all experience. It helps with feeling in control. It helps with feeling understanding. It helps with mastery and agency and is freeing. And for me, has helped me feel more connected to other humans, all other humans, because of my appreciation for universal experience. So I cannot recommend more highly. Learn these skills, explore them. Not all of them are going to fit. Not all of the words are going to be right for you. Replace them with words that work for you, but explore community because community helps enormously.